بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك أنت العليم الحكيم. My topic today is about ultrasound of the kidney in adult patient. Renal ultrasound protocol. Before the protocol, we should identify why we're doing the ultrasound of the kidney to patient with flank pain, patient with hematuria, follow up previously identified pathology, classification of mass if it is solid or cystic, post-surgical complication, guidance for aspiration, biopsy or intervention post-injury. There is there is some limitation in identifying of the ureter, and there is also some limitation in the upper ball mass lesion seen due to refractive edge shadowing. We should start it with the probe, depending on the patient size. If it is the patient is pediatric thin patient, we can start with 7 megahertz. If the patient is obese, we can start it with 3 to 5 megahertz, depending on the size and build of the patient. We started in supine position, and sometimes we can also do the decubitus position. Sometimes we can do also the patient in a prone position. We should do also comprehensive examination of urinary tract, including the prostate in male patient. We started in the supine position for the right kidney in the subcostal under the surface of the liver, and we can do the sagittal, longitudinal, and the transverse cast. And on the left side, we can elevate the left side little bit up and do also subcostal, and we see the the spleen, and we can take the left kidney, and we should do the vascularity of the each kidney. Here in the patient with the little bit right side up, and the see the kidney, and here you see the renal sinus, and this is the cortex, and the hypocork area, this is the medulla. Again, we can do the transverse cut. What we want to check in the kidney ultrasound, we want to see the size, we want to see the cortical thickness. It should be not less than 10 millimeter. We should see the corticomedullary differentiation, and we see the cortex at least is hypoechoic than the liver in normal patient, and the pyramids and the medulla are hypoechoic relative to the cortex. No hydronephrosis, and we look for scarring or any mass lesion seen. We should take the kidney in long axis and the transverse axis and measure it in long axis, and also measuring in short axis in the upper, mid, and lower ball. And we should also include the upper and lower ball of each kidney, and we should see also the vascularity of each kidney. Normally, the kidney is between 9 and 13 centimeter in long and 3 to 5 centimeter in width. Normal kidney cortex is less than echogenic than the liver, and cortex is more echogenic than the medulla of the pyramids. Pyramids is less echogenic than the cortex, and central sinus it is consisted of renal pelvis, fat, and blood vessels. Ureter As we said, we cannot see the ureter unless it is dilated. Here we see the right kidney, long axis of the right kidney. Here this is the renal sinus, and here this is the cortex, and it is less echogenic than the liver, and the pyramids or medulla is less echogenic than the cortex. And here we see the vascularity of the kidney, and here we see the upper ball of the right kidney and the lower ball of the left kidney. And here this is the transverse cut of the each of the right kidney. Uh, we see at the level of the hilum above and lower, and we should see also the vascularity. And here we should see the this is the kidney in the left side, and this is the spleen, and this is the vascularity and upper and lower ball of the kidney. And here we should see also the transverse of the kidney. And thank you very much for listening. Hoping you will benefit from this in daily practice and hoping to see you soon.